All right. Good morning, everybody. Welcome to 2020-2021 influenza vaccine recommendations. My name is Andrew Promoson, and we're coming to you from Los Angeles County Department of Public Health Vaccine Preventable Program. We have these learning objectives here for you today. We're going to discuss why influenza vaccination is especially important this year and this season. Number two, describe the changes to the ACIP recommendations for the 2020-2021 influenza season. Number three, identify persons at increased risk for complications associated with flu. And number four, discuss the benefits of flu vaccinations for pregnant women and their infants. Number five, identify new contraindications and precautions to LAIV. And number six, discuss the standards of adult immunization practices. All right, let's talk about a little bit of the flu basics. Flu is a respiratory illness caused by the influenza viruses that can infect the nose, throat, and lungs. Influenza can cause mild to severe illness and even death sometimes. It can infect anybody, even healthy people. The best way to prevent the flu is by getting a flu vaccine. There are other ways, but we're going to talk about all these things in this presentation. A little bit of quick flu facts. Influenza is a very common illness. Up to 20% of the United States population get the flu on an average year. And most people with influenza themselves and stay at home, rest, and stay well hydrated. It usually takes about 3 to 7 days for a regular case of illness to go away. You might have a cough and fatigue for more than 2 weeks. Usually the cough and the fatigue are the first things to come on and the last things to leave. About 200,000 average number of Americans are hospitalized each year because of either influenza or problems with influenza. And about somewhere between 3,000 to 49,000 number of people die each year from the flu. The latest numbers we have here for you are the death rates in LA County in 2017-2018 season, and you see for yourself it was 158. I know these numbers are not that huge compared to COVID numbers, but still very significant. The influenza virus is spread mainly from person to person from those that have influenza and cough and sneeze. These create droplets, and the droplets may be propelled about 3 feet through the air. This is why we're seeing all these recommendations with COVID as well as influenza to stay more than 6 feet away from each other. People may also become infected by touching an object or a surface that has the influenza virus on it, and then touching their mouth, their eyes, and nose, and transmitting the virus in that way. The incubation time for influenza is usually about a day before symptoms appear. And remember, I said that's usually a cough and you know, that feeling of tiredness. And it may develop and last and you may be infectious for 5 days or a little bit longer after becoming ill. The period when an infected person is contagious depends on the person's age and the health of the person. We know for sure that young children and people with weakened immune system may be contagious for longer than a week. So the time period for exposure to development of symptoms is anywhere, you know, about 1 to 5 days with an average of 2 days, as you see here. Influenza complications, you know, these are things that flu can lead to. It can lead to pneumonia, either primary influenza pneumonia or secondary bacterial pneumonia. It can also lead to encephalitis, which is the inflammation of the brain. It can lead to myocarditis, which is the inflammation of the heart, or the myositis and rhabdomyolysis, which are the inflammations of the muscle tissues. Multi-organ failure, such as respiratory and kidney failures, have also been seen. We've also seen sepsis, and we've seen the worsening of chronic medical conditions, and then, of course, ear and sinus infections. Let's talk a little bit about, we spend a lot of time on COVID and what's going on with COVID, but let's talk about what's going on with flu in the time of COVID-19. So every year, influenza sickens millions of people in the United States. And this year, we have the combination of COVID-19 pandemic and on top of it, the seasonal flu epidemic, which we're worried about. And we're worried about stressing the healthcare system as a whole. Because of the COVID-19 pandemic, reducing the spread of flu this year is more important than ever. So we don't exactly know what will happen this year as far as the combination of flu on top of COVID-19. But it's likely that both of these things are going to be circulating around as they are this year, and people will become co-infected with both flu and COVID-19. And this will result in more hospitalization and more death. So these are the things that we are trying our best to prevent and limit in our efforts. Everyone needs to stay healthy during the pandemic as much as possible. This is especially important for pregnant women and older adults and people with chronic illnesses such as diabetes, heart disease, asthma, HIV, or any sort of complication that renders you at a higher risk for serious flu complications. Influenza and COVID are disproportionately impacting our population. We're seeing higher numbers of cases in people who are experiencing homelessness. That's that PEH that you see here. And then also in communities of color. Communities of color also have lower rates of vaccination. So this is kind of a double whammy that we're seeing higher impacts and then lower rates of vaccination. This is a slide about age-adjusted death rates due to COVID-19. And this data is from August 25th of 2020. And you can see for yourselves that African Americans and Hispanic Americans continue to be at a higher mortality rate due to COVID-19. It's important to note that other populations as well have other populations of color have higher rates compared to those of whites. And this is a slide about the flu vaccination coverage rates among adults over 18 years old. This data is from the 2018-2019 year. And we see that overall, we had about a 45.3% rate of people being vaccinated in the United States. We see here, like I was telling you earlier, that Blacks and Hispanics have a lower coverage rate of flu vaccination than others. So, like I was saying, that this is a double whammy. We have lower vaccination rates and we have a higher burden of disease. So I tell you all this to relay upon you how important it is for you to talk to the community and all those people that you come in contact with and let them know about these facts and about what we can do to prevent these things from happening. I thought this is a really good slide about the differences or the similarities between cold, like a regular common cold, which is usually bacterial, and then influenza, and then COVID-19 symptoms. Okay. One thing that we see for sure is that flu and flu alone has a very rapid onset. It really comes on hard. You have about a day or so of, oh, I don't feel good, and a cough coming on, and then it really comes on. You cannot go to work, can't go to school. It really flattens you, and that's how people really describe it. That it was just came on like gangbusters, and it is tough. With cold and even COVID-19, we've seen sort of a slower onset than we see with flu. You see in trouble breathing, pneumonia, and chest discomfort and infections is true for all three things. Okay, it can symptom of all three things. With death rates, of course, we're painfully aware of more than 210,000 Americans that have died due to COVID-19. With flu, I showed you the numbers for 2018, 2019. It's not quite as high as COVID, but we still do see a high death rate with influenza. The common cold, you usually recover. Fevers, we really see fevers more in influenza, the higher fevers. With COVID-19, there are some cases that do experience fever. There are some that don't experience fever, so it can vary. Headaches, again, more common with flu and COVID-19. But cough is really present in all three diseases. Aches, chills, and weaknesses. Usually with chills, and it's kind of more rare in a cold, but we do see that with flu and COVID-19. Runny, stuffy nose, sore throat, sneezing, present in all of them. Nausea, vomiting, diarrhea, more common in children, but we do see some cases in the and also COVID-19. Fatigue and tiredness, also in both influenza and COVID-19 viruses. And then the loss of taste and smell. That's really a hallmark of COVID-19, and that seems to last for quite a while. That sort of loss of sense of taste and smell. The transmission is kind of similar in flu and COVID-19. Remember, they're both viruses, and they can both spread easily through respiratory droplets. This is mostly seen in sneezing and coughing of a person that is sick and being transmitted to another person. With COVID-19, we've seen the spread by near aerosols. This is why they're telling us to put our masks on at all times, even when you're on the elevator by yourself. Wear your mask because it can be aerosolized. Contact with objects is a less common way of spreading, but it can certainly happen. So, all that cleaning of surfaces and hand hygiene is the one that goes along with that. The other prevention strategies can be wearing masks, social distancing. These things may all reduce the spread of flu as well as COVID-19. So hopefully some of these measures that we're taking and all these precautions that are in place will help us in reducing the number of flu cases this year. Just remains to be seen. For incubation, flu is usually, 1 to 4 days of incubation and COVID is a little bit longer, as you see here. Contagiousness, highly contagious. Flu is contagious usually a day before any of the symptoms come on. With COVID, it can be a couple of days, even more before the symptoms come on, and up to 10 to 14 days after. So I know that we're doing a really good job of, taking all these precautions when people come to our clinics and, taking their temperature and all these things. But remember these facts that, symptoms don't necessarily need to be there before you're contagious. All right. So be very careful and aware of those things. Our core recommendations remain to annually and every year flu vaccines. Okay, for everybody 6 months and older needs to have their flu shot every year. Remember, if it's the child's first year of getting influenza vaccine, they need 2 doses of it. For everyone else, it's just 1 dose per year, every year, or every season, I should say. Vaccinate before the end of October. This would be a great way to get ahead of it and hopefully, prevent somebody from being sick and therefore being contagious. But continue throughout the flu season and as long as flu is circulating. That goes well into next year. And, we hit our peak sometimes in March and April. So the vaccine expiration date is usually the last day of June of the following year. And go ahead and continue to vaccinate until the expiration date. This year they came out and said vaccinating too early, as some people get it in July and August, may lead to waning vaccine immunity. So you may have less than optimal protection when the flu is really circulating at its highest peak. So we're recommending basically now everyone to get vaccinated with the flu shot. If they were vaccinated in July or August, we don't need to give a booster or a second dose. Emphasize vaccination of high risk group and their contacts. That's important to note because that's me and you. We're the contacts of lots of high risk group people. These are my high risk populations that I was talking to you about. Children, just by their age, are more likely to suffer from complications. So children aged 6 to 59 months, and also adults over the age of 50. Of course, those people that have chronic medical conditions and those that are immunocompromised for any reason. You can be immunocompromised because you're missing a spleen, or you've suffered some sort of injury, or you were born with some sort of immunocompromising condition. You can also be immunocompromised due to a medication that you're taking. You can also be immunocompromised because you have an infection like HIV, and that renders you immunocompromised. So lots of different reasons that a person can be immunocompromised. Also, women who are pregnant during influenza season or plan on being pregnant during influenza season, just by being pregnant, that makes you a little bit more immunocompromised and more susceptible to influenza and COVID. Children and adolescents age 6 months through 18 years of age who are receiving aspirin containing medications. Some diseases require this, that they receive that. So you want to ask about that. Are they receiving aspirin therapy? That makes you more immunocompromised. And then residents of nursing homes and long-term care facilities. American Indians and Alaskan Natives, and people who are extremely obese with a body mass index of over 40. And then all of us who are caregivers and contacts of these people. That includes me and you, like healthcare personnel. This is not just all paid personnel. This is for all the volunteer staff and students, anyone who is in contact with those people that are at risk. This includes household contacts and caregivers of children that are less than 5 years old, especially those kids that are less than 6 months old. Household contacts and caregivers of persons with medical conditions with increased risk of severe complications. So a lot of people. Let's talk about our influenza vaccine for this year or this season. We have our egg-based vaccines that are basically grown in chicken eggs, and they clean it up and they try to get all the egg protein off of it when they get the vaccine from it. But there's a little bit of egg usually left in it, but it's usually grown this way in chicken eggs. And you see the different types of influenza that are in there. Influenza, it covers a gamut of diseases, okay? There's a type A and a type B, and even within those subgroups, we have lots of different variations. So we do our best to match what was floating around last season and put that in our vaccine for this season. So for this season, we have two types of A vaccine, as you see here, and we have one type of B vaccine or B virus in this vaccines. The IIV stands for inactivated influenza vaccine, and LAIV stands for live attenuated influenza vaccine. The numbers 3 and 4 refer to how many different subgroups of influenza viruses are contained in the vaccine. Obviously, 4 has one more than 3. And it has the same A's, it just has an extra B added to it. In addition to my egg-based vaccine, we also have some cell culture-based vaccines, and these are not derived from chicken eggs, and they don't have any egg particles in it. So all those people that have egg allergies, and we'll get into that more in detail as we go on here, they can get this vaccine. So this is kind of what I was talking to you about the abbreviations. The IIV stands for inactivated influenza vaccine. This is inactivated, it cannot cause disease. And we also have the IIV4, and the CC stands for cell cultured, no egg in it, it's grown in cells. We have the 3 and the 4 that we talked about. We also have the adjuvanted inactivated influenza vaccine. It means it has an adjuvant or a protein binder that helps carry the viruses into the cell to get a better immune response. Okay, it has a protein adjuvant. We have the high dose vaccine that has more of a higher dose in it, and it's really good for people that are immunocompromised or people that are elderly that can receive a higher dose in order to get a better immune response. And then we have our standard dose. We also have the recombinant influenza vaccine, and then we talked about the live attenuated influenza vaccine. This is my FluMist. Okay, it's given intranasally. It's the only one that is live, or it's live attenuated. Attenuated just means weakened. So it cannot cause disease for the most part, but we don't want to give it to somebody that is immunocompromised. And we talked about the 3 and 4. We have trivalent with 3 different serosubgroups, and quadrivalent with 4 different types of influenza vaccine viruses in the vaccine. These are all the vaccines that we have in the United States, okay? Look, you can see for yourself, if you're younger than 6 months, you don't qualify for any of my vaccines that are available in the United States. So this is a really high-risk group, and we can't give them anything. So we want to make sure everyone that is going to be in contact with this group is vaccinated. You see here for yourself the different vaccine types, and then you see the age category that it's approved for. I want to tell you that the 6 through 59 months of age, the amount of vaccine of different ones of these they get can vary. Okay, so the dose can vary. You got to be really careful, especially if it's their first time receiving the vaccine, on making sure that you have the right vaccine and then you have the right dose on hand, depending on the age of the patient. For LA County vaccine, I believe we're going with all quadrivalent vaccine, which is for this season, which has 4 different serosubgroups in it, like we were talking about before. There are different variations and different brands. We don't prefer one brand over the next. ACIP does recommend that when you can, if you're given 2 doses to the baby for the first time, that you give 2 doses of the same vaccine. But if you don't have the same vaccine, you can interchange these, okay? You got to pay attention to the age category and who qualifies for it, okay? And we'll get into egg allergies and all of that in a second. All right, let's jump into vaccine recommendations for kids 6 months through 8 years of age. If it's a child that is receiving their vaccine for the first time, remember, we want to give them 2 doses of vaccine separated by at least a month, okay? So we give a dose today, for example, and we tell them to come back a month from today to receive the second dose of influenza. What happens a lot of times is that they forget or they don't come back for the second dose, okay? So let's say last year was their first time receiving the vaccine for the first time, and they were supposed to get 2 doses of vaccine, but they either don't know or they only got 1 dose of vaccine last year, and it's their second year. So if it's their second year, they only receive 1 dose or they don't know, we give them 2 doses again this year, their second year. If it's their third year and the previous 2 years, they only received 1 dose of vaccine, we just give them 1 dose of vaccine this year, okay? So the first 2 times that they're receiving the influenza vaccine is really important. And if they have not received 2 doses the first time, we want to give them 2 doses the second time. I hope that makes sense, and I hope you can follow this slide to make more sense of this. All right, let's jump into the people that say they have severe egg allergies. Lots of people, by the way, say that they have severe egg allergies. But this is a good slide to kind of go through, oh, okay, you have severe egg allergies. Well, when the patient eats lightly cooked eggs, such as example here in scrambled eggs or cake or any baked goods, do you have a reaction? If they say yes, we administer the inactivated influenza vaccine, or if they're healthy, we can give LAIV or RIV and observe them for 15 minutes. If they say, no, I cannot eat lightly cooked eggs, then we ask, what happens? I'm sure you've eaten them one time before. What happens to you? After eating eggs or egg-containing food, do you only experience hives? If they say, yes, I only experience hives, again, they can receive any of our vaccines, and we just observe them for 15 minutes if it's only hives. But if they say, no, it's a severe allergic reaction when I have any egg-containing food, such as I have cardiovascular changes, I have respiratory distress like wheezing, and I have nausea, vomiting, or I required epinephrine or emergency medication, then we can administer these things that are not from eggs, that have no eggs in them, and we observe them for their reaction. If it's a severe allergic reaction to a previous dose or egg-containing food, then we might want to have them in an inpatient setting where we have our emergency medication ready to go in case there's a problem. But remember that even if they have egg allergies, we have vaccine that contains no eggs in it. Now moving on to pregnancy and vaccine recommendation. Lots of people falsely believe that just because they're pregnant, they shouldn't receive a flu shot. And it's the exact opposite of what is true. Pregnant women are at increased risk of serious illness from flu due to changes in their immune system and just by the pressure that the fetus is putting on the heart and lungs. So they're just more likely to have complications from flu, and they're more at risk for getting flu. Um, these are complications that can happen during pregnancy. It can lead to premature labor, small gestational age for the fetus, hospitalization, and even death. So you want to educate those people that are pregnant or that are planning on becoming pregnant in the flu season and tell them that for sure you need the flu vaccine. Um, this is what we've seen with complications of a type of influenza, which was the H1N1. We remember we had a big pandemic about that in 2009. And we did some studies on pregnant women who were more severely affected with H1N1 influenza. This study looked at 347 pregnant women in the United States that were infected with H1N1, means they tested positive for H1N1 and were positively pregnant. Out of these 347, 272 were admitted to the ICU. 49, that's a really high percentage. 49 infants were born prematurely. 75 of them died. 45 deaths occurred in the third trimester, which is horrible. And 40 had underlying conditions such as asthma, diabetes, and obesity. So, really high percentage rates of pregnant women becoming severely affected with influenza and having really, really bad outcomes. Flu vaccination is absolutely recommended for all pregnant women during any trimester. That's important to note because with things like Tdap, we only recommend it during the late second or third trimester. With influenza, we're saying anytime during pregnancy. The flu vaccine has continued to be very, very safe vaccine for everybody, not just pregnant women and the fetus, but everybody. It's a very, very safe vaccine, one of the safest ones we have. It's okay to give if they're breastfeeding or planning on breastfeeding. It provides protection not only for the mommy, but for the unborn baby. And then as soon as the baby is born, remember, we can't vaccinate the baby until the baby is 6 months old. So the biggest contact that baby has is usually with the mother. So if the mother is not bringing the disease to the baby, we're really increasing the likelihood of the baby not getting influenza. Uh, the pregnant mommy may receive inactivated influenza vaccine, the trivalent or the quadrivalent. One thing that we don't want them to get is the FluMist or the LAIV. Do not use vaccines from a multi-dose vial with these people. Some multi-dose vials have a little bit of mercury that is used as a stabilizer in the vaccine. Remember, it's a multi-dose. So we don't want to give those to pregnant women and kids that are less than 3 years old. Administer Tdap if the woman is pregnant and it's during the second or third trimester and you're assessing for influenza vaccine. Remember to also check for Tdap vaccination at this point. We're very worried about flu and pertussis portion of the Tdap vaccine in the fetus. Let's talk about contraindications and precautions to vaccinations with influenza vaccine. Contraindications are sort of like my red light. You absolutely have to stop if patient has one of these conditions. With precaution is more like a yellow light, and we want to take precautions and kind of proceed with caution. So here's the red light ones, or the contraindications. All right, if you have received a flu vaccine before and you had a severe reaction to it or some of the components that's in the vaccine, then we want to stop. Okay, we don't want to give you something that you had a severe allergic reaction to. So that's why we use our pre-screening questionnaire and we ask them, hey, have you received this before? Did you have a really bad reaction? Most people say no, but you want to check all these things. With LAIV, remember that's my flu mist. That's only approved for healthy people ages 2 years old to 49 years old. All right, absolutely healthy. So if we're going to give LAIV and they have a diagnosis of asthma or wheezing within the last 2 months, then we don't want to give them LAIV. We can give them the inactivated, okay? We do not want to give them the live one. If they're using aspirin therapy in children and adolescents, we don't want to give them the LAIV. If they're immunocompromised for any reason, we don't want to give them LAIV. If they have close contacts or are caregivers of somebody that is severely immunosuppressed, then we don't want to give them LAIV. Also, if they're a pregnant woman, remember, we don't give them the LAIV or the flu mist. If they have cerebral spinal fluid leaks or cochlear implants, this is a new one, we don't want to use flu mist. And if they received antiviral medications, this can be because of any reason, but if they had COVID and we've seen a lot of antivirals, then we want to stop with giving LAIV. These are my antivirals. It seems like we're getting a new antiviral on board like every week now. We used to just have these two. Now we got a lot more coming on the list. But remember, if you're receiving an antiviral medication and we give you a virus, whether killed or attenuated, well, then you're not going to get the immune response that you wanted, and your body is not going to react to that vaccine that we're giving you. So you have no protection. Okay. So if you're receiving antiviral medications, you want to refer back to this slide and you want to make sure that you have waited the proper interval. So with these ones, 48 hours before the 2 week after LAIV, 5 days before to 2 weeks after LAIV, and then 17 days before or 2 weeks after with this one. So just remember that if you're receiving antivirals, especially with LAIV, we want to wait. Moving on to precautions, remember these are more like the yellow light. And if anybody's had a history of Guillain-Barré syndrome within 6 weeks of getting influenza vaccine, then we want to be very precautious about that. Usually if someone knows how to pronounce Guillain-Barré syndrome, then they know about it. They have it. So you ask them about that and they say, what's that? And they say, okay, if you don't know what it is, you probably did not have any of these problems. Temporary deferrals. If somebody is sick today, with or without fever, we usually don't want to vaccinate them. Okay. That's a clinical judgment on how sick they are. But if they're moderate to severely sick today and they're coming in for really bad cold or something else, then we want to defer the influenza vaccine and other vaccines until they're feeling better and they come back and we can vaccinate. If they're suspected or confirmed with COVID-19, regardless of symptoms, we want to postpone or defer until they're feeling better. Patients should be reminded to return for flu vaccinations once they have recovered, right? Once the symptoms and everything goes away, you come back. Usually that's within 2 weeks. If you wanted to, you can make an appointment for 2 weeks from now to bring them back. Hopefully they're feeling well at that point. With LAIV, remember, it's got to be for healthy people 2 years old to 49 years old. So if they have asthma, even if they're older than 5, we want to be taking precautions. Or if they have any sort of underlying medical condition, we really want to go to the inactivated influenza vaccine. All right, let's talk about a little bit of patient care before administering vaccine. And I like this picture because they got this poor kid sitting here, and this lady is just drawing up the vaccine with a big old needle in front of her. So try not to do that because you'll scare people, not just kids, but adults too. You know, if you can, unless they want to see it, some people want to see you draw it up, then that's fine. They can see it, but ask them because most people don't want to see that action. It makes them more anxious. Of course, you want to get a complete history at every health care visit, right? You want to know what's going on. What have you seen any sort of changes? You want to use your pre-screening questionnaire and ask about the contraindications and precautions. And then you want to talk about the benefits of vaccination. Look, the vaccine is really safe. It prevents really bad things from happening. I got it. Please, you get it because we don't want to spread this stuff. This type of conversation. You can provide them the VIS. Remember the vaccine information statements. They can be found online. They can also be pulled up on someone's phone if they prefer to, you know, like the new generation, all they're doing is they're in their phone. So they prefer it that way. You can pull it up on their phone, and then you should provide them with some aftercare instructions on what to do. This is my pre-screening questionnaire, one of the ones we use. It's available at immunize.org if you're interested or you haven't seen it. It's a nice one. You know, are you sick today? Do you have any allergies to the vaccine or any sort of components? Remember, there's a little bit of mercury or thimerosal in my multi-dose vials that does not exist in my single-dose vials. Have you ever had a serious reaction to influenza vaccine in the past? Have you ever had Guillain-Barré syndrome? And like I said, they usually say, "What's that?" And that's usually your answer. Document the VIS edition date that is usually on the bottom right-hand corner. Conversely, we haven't had a new one come out yet for this year, so it's going to have the same date as last year for now. But just keep up with immunize.org to see when there's a new one available. All right, let's talk about a little bit of vaccine administration. That's what gets everybody scared. You know, with vaccine administration, we always have, with any sort of injection, we have the 7 rights. And these are universal rights, you know. But one of the things that we don't really talk about that much is hand washing and how much that makes a big difference. I tell everybody that I'm training to make sure that you wash your hands in front of the patient and parents when you can with soap and water. When you don't have soap and water available to you, you can go ahead and use a sanitizer and sanitize your hands in front of them for cleanliness, and just it puts people at ease that okay, this person is clean and they don't have any germs. And even though you could have just washed your hands right outside the room, make sure you do that in front of the patient. And then of course you want to make sure that you got the right patient. I know that seems kind of elementary to talk about that, but lots of times we have twins in the room, and or we have a few kids in our vaccine administration room, and we don't know who's who. And I tell everybody this. I used to play this trick on my brother all the time. And we go to the clinic and they say, who's getting the vaccines today? And it's supposed to be me. And I point to him and say, he is. And so my mother would have to step in and be like, no, 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 he's getting them. So make sure, you know, you check with the adult who's the right, you know, you got the right patient. Then you want to make sure you got the right medication. Remember that not all flu vaccines are created equal. They have different age recommendations and all that. Make sure you got the right time, the right dosage. That's important because remember, for the little tiny kids that are getting it for the first time, the dosage may be different. It may be 0.25 cc versus 0.5 cc's. So make sure you got the right dosage here, the right route and technique. Remember that my LAIV flu mist is given by intranasally, and how we give it. IM injections for the most inactivated influenza vaccines, and those are given via 1-inch needles in the deltoid or the vastus lateralis, and we'll talk about that. The right site, where did you give it? Was it in the left deltoid, right deltoid, right thigh, left thigh, and then the right documentation, that you make sure you document everything you give it. This is a universal 7 rights. The anatomical sites of where we're going for inactivated influenza vaccine, we're either going in the thigh or we're going in the deltoid. And these are the locations. If the baby is, usually age is 0 to 36 months. Remember, this is more of a size thing than an age thing. But usually around this age, we're going in the thighs, the outer aspect of the mid thigh, right about where this is going. We use a 1-inch needle, 23 to 25 gauge. We come in at a 90-degree angle and insert the needle all the way in. Okay, I realize some of these babies have thin thighs. Okay, but you can pinch it and go deep into it. If you don't go deep enough into the muscle tissue, you don't get the immune response that we're looking for. So you've wasted the vaccine. All right, it's important that we get deep in there. Definitely those 3 and above, we can get it in the deltoid. Again, 1-inch needle. If the person is large, they may require a 1.5-inch needle. Remember, we're trying to get deep into the muscle tissue to get the good immune response so we can have an effective vaccine. Remember not to give the LAIV or FluMist via IM. This happens, okay? So be careful with this. With intranasal vaccines, we're really not used to it as a whole. With intranasal stuff, these are the steps. You want to check the expiration date, as you always do with everything. If the expiration date is today, we can use that vaccine today. If the expiration date was yesterday, then we cannot use that vaccine, okay? So even if it's today, we can use that vaccine. Remember that. Remove the rubber tip, as you see here, has a little rubber tip right here at the end of it. Do not remove the dose divider, which looks like a little hair clip, a little small clip right here in the midst of this. Don't remove that. And you just put the tip of the applicator inside the nostril, and you tell them to breathe normally, and you rapidly depress the plunger, and you want to create a mist. Okay, you don't want it to drip out. When you push it real fast, it creates a mist, and you push it hard, and then you remove the little hair clip and put it to the other nostril, have them breathe normally, and again push it really hard to create a mist, and we're done. Whatever comes out or drips out, or if they sneeze or whatever, we don't repeat the dose. Okay, that's it. That's it with the flu mist. We never ever inject this stuff. It's not a lure lock tip where it fits a syringe. The syringe doesn't fit a needle normally, but you'd be surprised. People have tried different ways of attaching it. All right. So this is only with flu mist. All right, adverse reactions and what we've seen as far as bad reactions. It's important to tell you that we don't really see that many severe reactions to influenza vaccine in particular in the whole United States. Very, very, very few cases, okay? What we do see sometimes especially with, with any sort of injection, you get a little bit of soreness at the injection site. You get a little bit of redness. It may swell up a little bit where it was given. We do sometimes see a little bit of headache, low-grade fever, and muscle aches. Very rarely nausea and vomiting in kids. These are usually signs that my inactivated influenza vaccine is working. Okay, it's getting a little bit of response from your immune system. It usually goes away within 2 days or so. All of these things should go away within a couple days. With LAIV, so going back here, these are actually good signs. Okay, they're not necessarily bad. It doesn't mean you got, oh my God, I got the flu shot and I got flu virus from it. No, it just means you got a good reaction from the vaccine, and now you're nice and protected. With LAIV, this is FluMist. We see a little bit of runny nose. I got it 1 year and I was a little bit dizzy after it for a little while. Headache, sore throat, cough, vomiting, and headache seen in some children, more rare. Remember, with LAIV, you got to be healthy and 2 to 49 years old to receive this. I don't know if we're going to have any of this from LA County or not, but just in case that you guys have some, these are the things that we have seen with it. Anaphylaxis is an acute life-threatening response. It happens really quickly, usually comes on within a couple of minutes. It can vary in how it presents, but usually the more rapidly that it comes on, the more likely the reaction is to be severe and life-threatening. This is due to something that was in the vaccine that's seen as an allergen. Okay, your body is severely reacting to it because it's seeing it as an allergen. Very, very rare, less than a couple of cases in LA County per year. But that's not to say it's never going to happen. Okay, so you want to be ready. You want to have emergency medication. You should have an EpiPen or epinephrine available for different ages. You should know what the dosages are and what the signs and symptoms are. Okay, it can be, closing of the airway. It can be rapid swelling of the throat. It can be hives and even loss of consciousness. All right. It can also occur more than 30 minutes after it happened, but that's also very rare. Okay, usually we observe them for 15 minutes, and if we're going to see something, we see it within that window. If they do have some sort of reaction, it can reoccur 4 to 12 hours after the initial reaction. So it's important for them to be checked out and be under the observation. Okay, remember, it's very rare. In case you do have a vaccine adverse event or something bad happen, we want to hear about it. And this is how you report it. Okay, this is Vaccine Adverse Events Reporting System, or VAERS for short. This is available online. It's available through your California Immunization Registry, which I hope all of you are using. But this is how you let us know and let the world know that there was some sort of side effect that happened after vaccination. This can be a life-threatening situation or hospitalization, prolongation of existing hospitalization, and disability and death, obviously. So learn about VAERS. If you have a real adverse event happen, this is how you report it. All right, vaccinating in the time of COVID. Well, we talked about, how we have all of the SARS-CoV-2 or COVID-19, however way you want to refer to it, going on, and it's circulating, and it doesn't seem to be going down in numbers. On top of that, we're coming on to the seasonal influenza, which is a different variation of influenza virus than what we're seeing in COVID. So we're very worried about these things coinciding together and causing more and more stress on our already stressed out healthcare system. So please, please push influenza vaccination this year, especially to reduce the stress on our healthcare system and to decrease the number of doctor visits and hospitalizations and reduce the number of testing kits that are being used, because these things are all at a shortage. Focus on adults at higher risk from COVID-19. Of course, you know this, but I'm going to read them to you again. This is the staff and residents of long-term care facilities, adults with underlying illnesses and conditions, communities of color, and adults who are part of the clinical infrastructure like me and you. Implement enhanced infection control measures. We're seeing this a lot, but lots of people are just ignoring these things. You want to screen patients for COVID-19 symptoms before and during the visit. Remember that they can be contagious before they have symptoms, and there's nothing we can do about that. We just want them to observe the physical distancing as much as possible, maintain 6 feet or 2 meters apart, limit and monitor facility points of entry, and install barriers to limit physical contacts with patients at triage. Respiratory hygiene remains at a high importance. Everybody should be wearing a face mask and face coverings for patients. Anybody that can tolerate it, 2 years and older usually. Teach them cough etiquette. You got to cough into your elbow. Hand hygiene, it's so important. We want to use sanitizers and soap and water. Enhance your surface decontamination. Remember that it can be passed on by contaminated surfaces. Of course, you can refer to guidance and ways to prevent things from happening. We're saying that now it's recommended that all healthcare providers wear N95 masks because of COVID when possible. Eye protection is of huge importance. If you don't wear glasses like me, then wear goggles where there's going to be moderate and substantial community transmission. Remember droplets, right? Droplets. I'm talking, I'm sneezing, all these droplets that you can't really see are coming at you. Optional are, to wear goggles at the areas where there's no community transmission, but I recommend you wear eye protection. Gloves are highly recommended, whether you're given IM or intranasal spray. Definitely with intranasal sprays, there's more chance of sneezing. So, and things getting on your hands. So wear the gloves, wear the eye protection, wear the mask. Ensure physical distancing during vaccination visits. We can do this by scheduling well visits and sick visits at different times of the day. That way, all those patients are not in the same area at the same time. We can maintain 6 feet of physical distancing. Excuse me. So this usually requires some sort of, putting barriers or signs and ropes and floor markings, for people to follow. You can also ask, patients to wait outside, like in their car. We'll text you when it's your time to come in to reduce the crowding in the waiting room. This works really well. If you use that system, only allow people to come in exactly when it's their time and reassure them that they're not losing their spot because they're not there. We'll contact you to come in. Our messaging and talking point, there's lots of myths and confusion and false beliefs about influenza vaccine. The biggest one, obviously, being that the flu vaccine gives you the flu. And this is far from the truth. Flu vaccine cannot cause flu illness. flu vaccines are mostly made with inactive or killed virus, or at least weakened virus in the case of LAIV or flu mist. And these things have been designed not to cause the illness. So you can't get the flu from the flu shot. This doesn't mean, however, that if you have flu, uh, uh, or you can't get it, or if you have a little bit of signs of the flu, like a little bit of that body ache and a little bit of fever a couple of days after that quickly goes away, that doesn't happen. That can happen, and that usually means you got a good protection against flu. But all that to say that it's killed vaccine for the most part, and it cannot cause you to have the flu. The flu is just a bad cold and not serious. That's not true. Flu is a virus, and it's way worse than a bad cold. It usually comes on suddenly and can lead to serious life-threatening complications and even death. So signs and symptoms may include fever, headache, fatigue, muscle aches, coughing, sore throat. It can lead to serious illness and complications such as pneumonia. For the most part, people do recover from flu by themselves, okay? But some people can suffer these life-threatening complications, and it can be bad. I used to get this from my father all the time. I never had the flu. I don't need to get the flu shot. I've never had it. I'm strong as an ox, son. Uh, uh, Most people get sick with flu at least one time in their lives, and often more than once. Some people who have only mild symptoms can still make other people sick. Okay, so remember that. Uh, these can be all sorts of people around you, like, somebody with a bad health condition, pregnant women, young children, or seniors, those that are at risk for hospitalization, even death. So if you don't get it, you're not transmitting it. So why wouldn't you get the flu shot? Flu, one of the other ones I get every year is flu shots are not safe and they don't work. It's true that a lot of times flu vaccinations don't prevent flu from happening. That part can be true, okay? That doesn't work 100%. That is true. But remember, there's only 3 or 4 different types of flu in the vaccine. There can be different types of flu floating around. For example, this year we have COVID-19 floating around, different type of flu than is in our vaccination, okay? But flu vaccines remained and have always been very, very safe. We've used them for more than 50 years. Hundreds of millions of doses have been given, and it really does not have bad side effects. It does not have any sort of those things and remains very safe. Most people that have some sort of problem report having a sore arm or low-grade fever and just body aches. Remember that flu immunization is not 100% effective in preventing all types of flu, but it is really effective in preventing hospitalization and serious illnesses and seriously bad things that can happen once you have the flu. So it lessens the burden of flu if you get it. In most parts, it prevents flu from happening at all. So it either protects you from having it or it lessens the burden of disease, does not cause it. So you want to talk about those things with people. Uh, Tell them that the benefit is flu vaccine can keep you from getting sick with the flu. Um, Flu vaccination has been shown to reduce the severity of illness in people who get vaccinated but still get influenza. Flu immunization has been shown to reduce the risk of flu illness, the risk of having to go to a doctor, and hospitalization and death. Flu vaccine is important preventative tool and the best thing we got right now for people with long-lasting health conditions such as immunocompromising conditions and hospitalizations. Flu vaccine can significantly reduce a child's risk of dying from flu. This is really important. Even if they get flu, they just don't end up being hospitalized or dying from it. Because of the COVID-19 pandemic that we're having, reducing the spread of respiratory illness such as flu this fall is more important than ever, right? These are some of the training and resources that I have available. EasyIZ, good training tools for you guys to look at vaccine storage and handling and vaccine administration and how to go about doing that. Vaccine storage and handling remains huge in maintaining our safety of our vaccine. CDC consideration for planning curbside and drive-through vaccination clinics. So all sorts of good information here for you for training and resources. And lastly, I want to thank you for spending some of your time with me today. If you have questions and want more information, you can always contact us at the Vaccine Preventable Disease Control Program. You see our website here at ip@ph.lacounty.gov, or our phone number is 213-351-7800. Thank you again, and remember, #PreventFluLA. You guys have a great, great day.